Asylum for the Insane, A History of the Kalamazoo State Hospital, presented by Dr. William Decker, Distinguished Life Fellow of the American Psychiatric Association.
In spite of the bad weather conditions that we're experiencing, temperature hovering around 40, moderate rain, and wind gusts extending between perhaps 40 and 50 miles per hour, we had a fairly large crowd join us this evening. There were estimates of approximately 150 to 200 persons in attendance. Among the attendees were former and current hospital employees and a few patients. I had prepared a list of 70 vignettes about the hospital and thought that perhaps we would have an opportunity to discuss some of those. Unfortunately, time ran out. However, we have with us Carol Van Antwerp. And Carol, after reading these vignettes, circled a few and said she had some comments that she would like to have me discuss with her.
Dr. Decker, I was curious about the first woman doctor who was hired at the state hospital.
Yes, that was interesting, Carol, that Kalamazoo, like in so many other instances, was the first to initiate certain activities. And hiring a female physician was one of those. 20 years later, the legislature enacted an act demanding that asylums for the insane, as they were still referred to at that time, and unfortunately, those asylums also took care of what they referred to then as the feeble-minded. Mm-hmm. That in those asylums that had women and girls, that there should be a female physician. But that legislative action came 20 years after Kalamazoo had already hired female physicians, and as the vignette indicates, in 1879, and so that Kalamazoo had superseded the legislature 20 years and had several physicians on the staff by the time that this legislation became effective.
I understand that Linda Richards, who was America's first trained nurse, was appointed the director of the Asylum Nurses Training School in 1906.
Well, that's true, Carol, and that's another one of the first for Kalamazoo. Kalamazoo was the first in the nation to have a trained registered nurse, and Linda was a very energetic person, initiated a lot of new ideas into the training of personnel at the hospital. She was responsible for providing special training in such areas as pediatrics and surgery and so on and so forth that couldn't be provided by the hospital itself. She arranged affiliate programs then with programs in Detroit at Detroit Women's Hospital and Borges and Bronson, the two local nurses training programs here in Kalamazoo.
And I know that's true because I stayed at Linda Richards when
Yes.
I was a student nurse, and there were other students from other schools of nursing, and we were all being educated in psychiatric nursing.
That's right.
And that building still stands.
Carol, now you were there at what time?
I was in nursing school. I was there from 1964 to 1967, so at Bronson School of Nursing.
Yes.
Mm-hmm.
Yeah. The hospital had affiliations with many different hospitals, primarily on the southwest side of the state. St. Mary's Hospital, Blodgett Hospital in Grand Rapids, Hurley Hospital in Flint, and of course Borges and Bronson here in Kalamazoo. And the affiliate program was approximately 3 months in duration, and those who wished did live in the Linda Richards nursing home.
Yes. The work week has certainly changed over the years. I noticed in one of your vignettes that the work week was reduced from 84 hours per week to 56, which seems like a tremendous number of hours.
Well, it was interesting, Carol. That was only the small part of it. Actually, what happened with the inception of the asylum, that employees were actually bound to give all of their time to the care of the patients. And I'm talking about those individuals that were employed there to provide direct care to patients, the doctors and the attendants. They had to live on the grounds, lived in the buildings with the patients, and they were expected to work at least 14 hours a day, and the other 10 hours they were to be available if needed. They were not allowed to marry. They were not allowed to leave the hospital grounds without permission from the medical superintendent. All of that gradually changed as the years passed by, and as you indicated, the workload or the work hours were reduced first to 80-some hours, then they were reduced to 56 hours, and then eventually to 40 hours.
Can you tell me about the School of Occupational Therapy that was established in the 20s?
Yes. The occupational therapy was an important aspect of the management of the care of the patients from the inception of the asylum. But it wasn't until 1922 when Marion Spear joined the staff at the hospital. At that time, she was unable to find any trained occupational therapists that would be willing to come to Kalamazoo, so she prevailed upon the medical superintendent at that time to start a school at the hospital. And that school did progressively grow. In 1935, at Western Michigan College, it was required for the students in occupational therapy at the hospital and to take a prescribed number of courses at the college. Later, in 1944, the program was transferred from Kalamazoo to Western Michigan University, and at the present time, much of that program is now housed in one of the buildings on the former state hospital grounds, the EWB building or the Elderly Women's Building.
One of the things I was struck by when I was a student at the state hospital during nursing school was that some people were mentally ill, ingested things that would never have occurred to me. And I know that there was a female patient who had to have surgery who was found to have 9 teaspoons, 11 forks, 4 common pins, 2 bobby pins, 2 pieces of glass, and 11 strips of metal 2 inches long, and bars of soap in her stomach. And this occurred back in 1947. Do you remember this?
I do, and I remember seeing the x-ray before she was operated on. And this was not an unusual sort of circumstance, but we have to remember that at that time, patients were not admitted to the hospital early in their illness.
Yes.
And this is a good reason why patients should be brought under care early in their illness. Today, I never read or hear of these kinds of things happening. Prior to 1947, it was fairly common that patients would swallow things like this. I remember seeing another x-ray of a patient that had swallowed a number of spoons,
Yes.
and it was interesting that these spoons were all set right, one on top of the other, as though somebody had reached in there, gathered the spoons and placed them.
On the x-ray, you saw
On
that.
the x-ray,
Yes.
yeah.
Yes.
But that's a good reason now why early treatment is important. With the early treatment that patients receive now, we don't see these kinds of things happening, or at least I never hear of them.
And in 1947, Thorazine would not have been used.
That's right. That was prior to the time of the introduction of the neuroleptics in 1955. And this kind of specific therapy was not available. those drugs made a tremendous difference in the care and management of patients. What I like to refer to as the first revolution in the treatment and management of the mentally ill.
Yes. Thank you.